EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. Every week I come before you with a face that's perfect for radio and say, guess what? We have a wonderful person that's with us today. And guess who didn't remember to turn off her phone? So excuse me momentarily while I get rid of this perfectly wonderful sound. So very sorry. So today is no exception, except that oftentimes I will have community organizations here, and today I have one of our own. I have Bonnie Andrus that I've asked to come before us. Bonnie is one of our nurses, and we have many nurses that are very good at a lot of different things, but we find that each of them has a special passion. For some, it's being a lactation nurse. For others, it's focusing on diabetes. For Bonnie, it's infectious diseases. And you will see Bonnie if you have any concerns about any of the infectious diseases that we can help you with, either preventatively or in treatment. But since it is now after the holidays and we are officially in flu season, Bonnie wanted to be able to talk to all of us conversationally about this season and how to stay healthiest during the flu season. So welcome, Bonnie.
Thank you. Thank you for having me. And I think it's important that we continue to be as healthy as we can be through this winter season area. And it's really cold here in Florida I mean, it's not as bad as up north, but It's still pretty cold for us.
I've seen memes on Facebook that have said, I'm ready to give up my winter subscription. I've changed my mind.
Absolutely.
And I think we're all at that point, but we have many months to go. Flu season officially doesn't end until spring begins. Is that correct?
It goes until May.
Okay.
So it's still important. If you haven't received your flu shot, you need to get out there and get it. Your COVID vaccine, they're still available as well. RSV vaccines, and we have the shingles vaccine for those that are still in need of shingles vaccines.
And the one thing that I usually hear with COVID and RSV is pneumo shots to help us with pneumonia.
Absolutely, yes. We need pneumonia vaccines for those who have compromised immune systems. And we also, for those 65 and older, they need to make sure that they talk with their doctor. And if you haven't received your pneumonia vaccine, then you should receive it.
And there's a couple of different ones, I understand.
There are, I believe there's 2 different strains. One is good for 2 years and one is good for 10, I believe.
Okay.
So it's important to make sure that you talk with your nurse, your doctor, and make sure that you get the right vaccines.
And it may be possible to get more than one as you age.
Yes.
Okay.
Mm-hmm.
Because I've heard other people debate that, and it's like, no, I think there are 2.
Yeah, there's 2 that you need to get.
And for those people who aren't 65 yet, I have heard some of our younger nurses talk about they wish that they could get the pneumonia shot, and it is scientifically possible. It's just an insurance situation. Is that correct?
I really wouldn't know about that.
But it doesn't hurt anyone who's 50 to get a pneumonia shot.
No, they need to talk with their doctor, and their doctor will help them make the right decisions.
Okay, very good. So flu is the hottest topic of this time of year.
Right. Influenza A has reared its ugly head and has affected quite a few people. And I think we're like 3rd or 4th in the country. At least we're not heading number 1.
Yeah, so it's good not to be number 1 in some things.
Right.
Yes. So the flu shot itself, does that change every year? I mean, if you had it at the end of last season, do you really need another one this year?
Yes, the strain changes with the highest variety of the illness of that spring. I think I was told one time that it comes from overseas first. So they get it at a different season than we do. And whatever's prevalent, then they make our vaccines off of what's most prevalent for that year.
So we don't have to worry about whether it's influenza A or B or...
No.
whatever strange name they give it.
Right.
Okay. And then do the children qualify to get flu shots as well, or do they have the little misty thing this year? Do you know?
I don't know about the mist thing. I do know that we do have vaccines still available from, I believe it's from age 6 months up.
Ah,
So they do have vaccines available for children.
okay. And that would probably be part of the regular pediatric dosing schedule for our littlest ones.
Yes.
Okay.
Yes. Again, go with your pediatrician. They'll tell you exactly. They'll actually look up your vaccines, and they're really good at making sure that you're following up and getting the shots that you need.
And it's my understanding from last year that the children actually need to have 2 flu vaccines before they're 2, because the first one they give as early as they can, but I think it's at 6 months, and then they need to re-trigger that immune system because they are young and their immune system isn't as fully developed as later on in their life.
Right. That's correct. They do
okay.
need 2 vaccines.
Okay. So again, getting 1 is nice, but 2 is the magic number for our children.
Right.
Okay. And so what other kinds of things can we do preventatively besides a vaccination?
Stay healthy by getting fresh air when you can, making sure that you're eating properly, make sure you're taking your vitamins. Get sunshine. It's really important. Even though it's cooler, you need to make sure that you're getting that vitamin D. These are all ways to help build your immune system. Eat healthy meals. Get plenty of sleep. Good hand hygiene is really important, making sure you're washing your hands. They say to sing to yourself, happy birthday to me, twice while you're washing your hands.
Wow.
And then also rinse them off, and don't shake them off. You should let them drain in the sink and then take a paper towel and dry your hands.
Oh, so not the common household towel.
No, you should have paper towels in your bathroom, and make sure you're throwing them away. Another thing is make sure you clean high touch areas often. Doorknobs, the countertops, backs of chairs. People don't realize that if you have visitors in and maybe they rub their nose and they're touching something, you should go around and clean these high touch areas frequently.
And with like a Lysol wipe kind of thing, or soapy water out of the sink? Or
You could use soapy water, just put a little bit of bleach in it. The bleach is really helpful. Or you can use Lysol, just something with disinfectant properties in it.
Okay. Yes, I can remember when my aunt stayed with us. She was Mrs. Clean, and she would go over all the surfaces, and she didn't care if we laughed. She knew she was doing the right thing for us.
Yes, and my mother's famous for putting bleach in her dishwater. But it does work. I mean, a little bit of bleach in your dishwater keeps your dishcloth clean, and also keeps to cut down on those germs and the different.
I hate to admit it, I never thought of that. So what other kinds of things, when we talk about getting fresh air and getting sunshine and vitamin D, I immediately think of the teenagers who like to be indoors, particularly when it's not sunny and they're bored. Hear that word a lot, bored. How do you suggest that we manage that?
Well, I mean, if the day is nice and they don't want, or if the day isn't nice and they don't want to go outside, you can crack a window or two a little bit, get some fresh air into your home, get that stale air moving, and get that, maybe get a fan or two running to help move around those particles in the air.
That's an interesting theory. I know the common ones, but while we enjoy fresh air, I don't think of it as having health properties per se. Up north, yes, because there were a lot of industries up north that were spewing things into the air out in California. But in Florida, we just automatically assume that the air we breathe is great already.
Right.
So that's a really helpful comment. So you mentioned the RSV, and that RSV used to be something that we knew as a childhood disease,
Right.
Particularly because the children couldn't get vaccinated against it, and they were particularly vulnerable from newborn on to that 6 to 8 month period. But now I hear it a lot in context of adults. I even saw it at one of the pharmacies as I was driving over to the studio, saying, get your RSV shot here. And I'm thinking, well, that's not for the newborns.
No, we actually do recommend that older population get the RSV vaccine as well. It may have been that RSV was prevalent even back when COVID was rearing its ugly head, but they weren't testing for it. So RSV is pretty prevalent in the older population as well. So it's important to get those vaccines.
And so is there a test for RSV?
There is a test for RSV, but they don't generally test adults.
Okay. Because the treatment is the same?
Yes.
Which is?
Well, it's a virus, so it has to run its course most of the time.
Okay.
So
stay inside, stay well hydrated, get plenty of rest.
And if you are ill, it's best to stay home, stay away from other people. If you're running a fever, recommend that you stay home for 24 hours after your fever. If you have to go out, make sure you wear a mask. I know we can't mandate masks, but it's important that you take care of yourself and take care of those around you. If you don't feel well, can you imagine making somebody else not feel well who has a lower immune system? They may not fight it off as well as you do, and it may create more of a problem for them.
So don't show up at your doctor's office saying, I don't feel good.
Call first.
Call first.
And they'll tell you exactly
Good
what
advice.
you should do.
Well, Bonnie, we're going to take a short word from our sponsors, and then we'll come back and we'll talk about some other infectious disease topics, okay?
Yes.
Great. Stay with us. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Right now at Sunshine Furniture, it's New Year sale time. Save up to 50% on selected closeout styles of Lloyd Landers, Berlin Garden, Capri, Universal Coastal Living, Four Seasons, and lots more. Sofas, dining sets, patio groups, chaises, umbrellas, occasional chairs, bedroom sets, coffee table, lots of pieces on sale now for inside and out. We're your local Tommy Bahama and Lexington store where you can create an island paradise and make your life one long weekend. Sophisticated looks with a mix of coastal and Caribbean style, Tommy Bahama Home has everything you need for your Florida living. Also, all pictures, lamps, and accessories are half price. Visit Sunshine Furniture now for our January sale. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Visit our website at sunshinefurniturecasual.com. Also, don't forget to shop our outlet and sales center just across the street.
Sunshine Furniture, the best in every way.
Giddy up and ride out to the Downtown Country Hoedown presented by GHO Homes. A big old party in Vero with live music by Justified. Midway games, a mechanical bull, line dance, and beer food contests and prizes. Admission is free. Presented by GHO Homes, Main Street, Vero Beach, Millennium Cremation Service, and Formula One Window Tint. Admission is free at the Downtown Country Hoedown. Friday, January 31st at 6 p.m. in downtown Vero Beach.
And welcome back to Community Conversations. If you're just joining, my name is Vicki Soule, and I'm the CEO of Treasure Coast Community Health. And every week I come here to talk with individuals that are much more knowledgeable than I about a lot of different things. And today is no exception in that. I have Bonnie Andrus with me. Bonnie is a nurse at Treasure Coast Community Health, has been for 6 years?
Almost 6 years.
Almost 6 years. Good guess. She and her husband both work for us. Butch is the big fella that you'll see at all of our construction and maintenance projects. He's been a terrific resource for us, as has Bonnie. Bonnie, as I said earlier, has a keen interest in infectious diseases, and we've spent a little bit of time about how to stay healthy during the flu season, which, by the way, lasts another 4 months or so. So it's not too late to get your flu shot. What about if you think you might have had a touch of the flu? Should you still get your flu shot, or will that not help? Will it be harmful to you?
I think you should still get your flu shot. It's recommended to the end of the season, which ends in June.
Okay.
It's really important that you stay inoculated against these viruses. Just because you got the flu once doesn't mean you can't get it a second time. So it's really important to get those vaccines.
And as we talked earlier, the flu virus has a way of changing, shifting, morphing, modifying, whatever adjective you want to put on it. And so what you had may or may not be what's coming down the pike, and the vaccine could help you.
Right.
So,
yes.
And when I say you, I'm obviously thinking about the whole family.
Right.
Because oftentimes the recipient hears you and they think about themselves as adults, not necessarily the kids.
Right.
And we all know that kids swap the germs when they go back to school. Do you have any idea what the incubation period is? I mean, if somebody came down to visit with you over the holidays, they went back, you went to school, is it likely that you're going to be perhaps shedding the virus through coughs or sneezes over a 1 or 2 week period after?
I believe you can shed the virus up to 1 week.
Okay.
It's important that when you cough or sneeze that you cover your mouth or nose.
And the preferred way I've learned is into your elbow now,
Yes.
not your hand.
Right. That's correct.
Okay. But a lot of washy-washy, as they say on the cruise ships, washy-washy-washy.
Right.
My kids always thought that was pretty funny.
I think the other thing is making sure that you don't touch your face, your mouth, your eyes often. I've heard it said that you touch your face between 9 and 90 times within an hour.
Well, it's got my nose itching right now as we speak.
Yeah, so and that's important, because if you touch something that may be contaminated and you rub your eye, or you pick at your tooth, which you shouldn't be doing anyway, but you put your hands near your mouth and your eyes, you can spread that virus to yourself.
So most of those viruses are spread through those kinds of fluid.
Well, they're air solubles, or they're through air, so you can pick them up. Somebody coughing or sneezing in your face, or sneezing onto you, and you touch something. I mean, you can pick it up.
Yes, that happened to me. I went on vacation for a week, and I was fine all week long. And as I was driving home, I started to get that tickle in my throat, and I thought somebody sneezed or coughed on me, and I didn't realize it.
Yeah.
So that happens. Bonnie, some of the viruses, most of the viruses we've talked about are aerosol viruses, and they are clearly symptomatic. When we say the flu, it could be runny nose, could be a sore throat, could be a cough. It could also be GI related as well.
Yes.
Right? But there are other viruses that we're exposed to that may or may not be symptoms. Chickenpox comes to mind.
Right.
You know, in children, it expresses in little pimply rashes, and as adults, it also is pimply as shingles.
Yes.
And so we know then that we've been exposed to those. But I heard recently that about half of the adults over 50 may have been exposed to a hepatitis virus that can still cause liver damage.
Yes.
And we're asymptomatic.
Right.
So is there a test for that? And if so, why is it important to get it?
Okay, so hepatitis A is something that you can pick up from getting tattoos, from getting piercings. If you were exposed as a young person, maybe helping someone who got hurt and they had blood to blood. It's highly unusual, but it can be transmitted sexually. It is important that everyone get tested for hepatitis and HIV at least once in your lifetime. It's really important because it's also curable. You can live for a very long time with hepatitis and not realize that you have hepatitis. One of the bad things about living with hepatitis is you can end up with cancer. You can end up with liver cancer from it. It's so important to get tested, and it's treatable. It's 100% curable. So there's no reason not to get treated. And if
Yay
money
for
is
the 2000s, right?
Right.
You didn't hear that in the 1990s.
Right, you didn't. But it is curable. So it's really important. And HIV, it's important to be tested for that as well. you can live a long time with HIV. As long as your immune system stays strong, you can live. Normally, that's not what takes the person out. HIV doesn't. It's something totally different.
Okay. So if someone had not been tested or had been tested a long time ago, is there a limit? Are the insurances covering it? What kind of testing protocols are there these days?
Well, you can get tested you can talk with your doctor. Most places want you to get screened for hepatitis and HIV.
Okay.
Most insurances cover it. If you don't have insurance, if you're uninsured or underinsured, you can go to TCCH, any of our sites. We will be more than happy to set you up. They can call me. They'll call me in to ask me, how do we do this? And we'll get them all set up with getting the testing done. You can do rapid testing. If you've never been tested for hepatitis, then you could do a rapid test, which takes 20 minutes to get the results.
Is that like a finger stick?
It's a finger stick.
Ah.
Yeah, so
See, in the old days, we just say, go to the health department.
right. No, you
But
can get
testing has
tested.
gotten a lot more well-defined,
Yes.
easier to do, less regulations because they've eliminated all the wrong steps that people were taking when they were doing it before, I guess.
Yes.
And so is it an expensive test to get?
I believe that if your insurance covers it, it does no cost to you. And for those who cannot afford it, we can also do rapid testing. And I believe at this time, we are not giving a charge for that, just for the nurse visit.
Okay.
So,
Very good to hear. So what kind of treatment options are there? I've heard that the medication is very expensive.
yes. Most insurances, like I said, cover the hepatitis medication. There's two different types that we use, Epclusa and Mavorite. Mavorite is a 8-week program. It is 2 pills once a day for 8 weeks.
Okay.
And the Epclusa is 1 pill once a day for 12 weeks. If you do not have insurance and you cannot find coverage, we work with the manufacturers of the product, and we're able to get that for you at no cost.
Well, that's wonderful. I know that's always been an objection. I don't know where to go. And even if I found out that I was positive and wanted to do something proactively about it, I don't have the insurance or I don't have the time. What are the side effects? Are there any side effects to these medications?
The most common side effects of the medication are stomach upset and headaches. And they can be mostly subsided by making sure that you take the medication with food.
Okay.
And also to drink plenty of fluid.
Doesn't sound too dangerous to me. Maybe I better get tested. Ignorance is bliss, but only until you roll into that period of remorse. Like, I wish I had gotten tested. I wish I had known sooner. I wish I had gotten the preventative screening tests that would allow me then to take actions. There's no do-overs in life. The days just keep moving forward. We don't get to enter a time machine yet. Right. So, any other things that you'd like to share with our listening audience before we wrap up?
Stay healthy and give us a call if you need anything.
Okay. Thank you so much for being here today. And thank you all for listening in. I know sometimes when I hear about flu or colds, it's like, yeah. The reality is times are changing, the diseases are changing, our treatments and our recommendations change. So I hope that you picked up something, if nothing more than a reminder of the things that you already knew that maybe we got complacent about. I know I'm going to go get some Lysol wipes and start rolling through the house again. As you said, we've still got many months of the flu season, and why not feel our best every single day that we can? So if Treasure Coast Community Health can help you do that, please don't hesitate to give us a call. We'd be very, very happy to take care of you. And